Hello, everyone. We're getting right at 4 o'clock here. So as people continue to filter in, we will get started here. Thank you for joining us for today's webinar. We're happy you're here. The course slides for this webinar are available through the link that's in the chat right now. And they're also available on the upcoming webinars tab on our education page, ultimatemedical.com/education. I'll post the link in the chat again if I need to during the webinar. If you have questions during the presentation, please put them in the Q&A section or the chat. We will monitor both of those and we'll have time for questions at the end. To obtain your CEU after this course, you must complete the survey at the end of the webinar. The survey should automatically populate after you leave the webinar. If it doesn't automatically populate, don't worry. The link will be available to you in the follow-up email you'll receive from Zoom in approximately 24 hours. And you should be able to access the survey through a link in that. With that, that's all I have right away at the beginning. Thank you everyone for joining us. I hope you enjoy the webinar and I will turn it over to Marianne.
Hi, everyone. Thanks for joining us. Good afternoon. My name is Marianne Girardi, a physical therapist and clinical education specialist here at Ultimate Medical. Today, we're going to be talking about what you need to know for successful CRT bath prescription for people with SCID. Basically, we're going to be talking about what you need to know about the person and the environment to get the best bath prescription. In my many years of being a physical therapist here in the Boston area, I've prescribed a lot of different bath equipment and a lot of equipment in general. And some of the things that I have noticed that we either forget or don't remember that we need to do, or we don't realize we need to do when we look prescribing bath equipment is listed today. So there's a lot of different stuff we're going to talk about. Told you I'm an employee of Ultimate Medical. Our learning objectives for today are to identify a minimum of 3 functional evaluation results needed for bath CRT prescription. Describe the environmental factors that affect CRT bath prescription. Discuss the indications and contraindications of each type of bath CRT equipment. First thing I want to talk about is what is complex rehab technology, or what is CRT? CRT products include medically necessary, individually configured devices that require evaluation, configuration, fitting, adjustment, or programming. These products and services are designed to meet the specific and unique medical, physical, and functional needs of an individual with a primary diagnosis resulting from a congenital disorder, progressive or degenerative neuromuscular disease, or from certain types of injury or trauma. So we're talking about bath equipment that is specifically configured for an individual to meet their needs that you have found in evaluation. The goal of bath equipment is to enable people to complete their activities of daily living safely and effectively. If it's not effective, nobody's going to do it. And if it's not easy, it's going to be hard. They did a survey and they found that consumer and caregiver concerns are the risk of patients falling during transfers, propelling, and while leaning over and showering. We have to remember that showering and bathing is not a static activity. The person needs to be able to move, to access areas that need to be cleaned or addressed during the bowel care program, or B, just to be able to reach to get to them if they're doing it themselves. Risk for pressure ulcers due to inadequate padding and seat positioning for lengthy bowel care regimes. I think this is true not just for lengthy bowel care regimes, but anytime anyone is sitting on a surface, we need to be cognizant of what the pressures are being delivered to the bony prominences and what the risks for injury from these pressures are. inadequate caregiver access to perianal area of the patient to perform bowel care procedures. We need to keep in mind that either the consumer or their caregiver needs to have access to their perianal area and the perineal area for hygiene and for their bowel care regimes, for stimulation suppositories, whatever they need to complete their routine. And if the equipment we prescribe and provide them doesn't enable them to do it, it's not meeting the needs of the patient. Wheel-related inability to properly position the chair directly over the toilet. I can't tell you how many times I have run into this. Because of designs, and we're going to talk about designs of toilets and designs of chairs and how they need to meet so that it is a successful use of the toilet and we don't end up with messes. No other way to say it. So first, we're going to talk about the evaluations that you need to do. It's both the evaluation of the patient and the environment that it's going to be used. And in some cases, you need to also evaluate the caregivers, how they're using it, what their limitations are, because you need, sorry about that, you need to be able to facilitate everyone for this to work. It has to work as a group. So first, we're going to talk about the functional evaluation. I think the first thing you need to look at when you're looking at prescribing CRT bath equipment is how is the person transferring into this equipment? Are they doing it independently? Are they doing it with help? Are they doing it standing? Stand step, stand pivot, stand squat. They each bring their own unique needs into what you're going to get for a chair or a bench. Are they doing a sitting transfer, slide board or a lateral hop? Then you need the surface heights, because we all know going uphill is not easy. Any obstructions in this transfer from the equipment you are going to provide and or the environment in which the products are being used. And then a mechanical lift. When you're using a mechanical lift, it brings in a whole different set of needs that you have to look at and take into consideration when you're getting the equipment in order for it to be successful. So what do you need to think about when you're ordering the equipment? If you're doing a stand pivot, you need to have armrests that are able to be moved out of the way effectively so that you have a clear path onto the surface. You also may need to have armrests that are sturdy and lock, because if you've got somebody who's doing an independent transfer and they're using that armrest for stability, they need to be able to trust it that the lock isn't going to let go or it's not going to flip back or move out of position. You also need to look at the leg rests. Are they able to be moved away so that you have a clear path for the lower extremities, for them to have a place to step and stand to pivot into? But also, if they're doing an assisted transfer, is there a clear path and enough space for the caregiver to be safely positioned and use good body mechanics when they're doing the transfer? They're not tripping over. I mean, we've all been guilty of, yeah, I don't need to move it all the way out of the way because, you know, it won't be, and then we end up tripping over it. When somebody's doing an independent slide board or lateral transfer, is that leg rest going to impede their ability to get what they're transferring from, mostly their wheelchair or their bed, close enough to the seating surface that they can make the transfer? So it's close enough. If they don't have a great transfer, you don't want to have that gap, because if they fall in between, they're going to get injured. You need to look at the wheels. Are the wheels and the height of the wheel positioned so that when they do their transfer over, are they at risk of hitting their backside and doing a skin tear, a cut, or a pressure injury? You also need to look at the wheels and the wheelbase for balance, just like a wheelchair. A lot of the seating is just like what you would do in a wheelchair, except you got wet bodies, which makes it even worse. So is the wheelbase big enough? Because I've had lots of patients that do an independent and they have this huge posterior thrust when they hit the seat, to the point where the chair sometimes rocks. Do you have enough stability in wheelbase that you're not going to tip over? Do you need to add anti-tippers, which then takes space in the back? But is the stability of the wheels what you need for what you're doing? I apologize. It should have been wheel locks and not brakes. I'm old. With the brakes and the wheel locks, first thing they need to do is to lock the wheels. You need a stable surface to be transferring onto or transferring off of. Using the equipment in a wet environment increases the ability for sliding. And if they does slide and the wheels locks do not maintain, you have potential for an accident. Unfortunately, because of the wet environment and the tires, even with the wheels locked, there may be some sliding, but you need to figure that out so that you can address it, either making accommodations on the floor or something else to stabilize that chair. Seat height is important both for dependent and independent transfers. If you've got somebody doing a slide board or a lateral transfer, you know you need the same height. It's just easier. You don't want to have to go uphill. But if you're doing a transfer and somebody's short, which happens a lot with shower chairs, if you've got somebody short, shower commode chairs, but you need the seat height high enough to get over the toilet, are they going to try to transfer and all they're going to do is catch the last couple inches of their buttocks on the chair, and then somebody has to lift them up and into the chair so that they're actually positioned in the chair? The whole thing is, you want, same as a wheelchair, you want the butt back all the way. So you may have to make compromises with the height and make a decision as to what, or in the case of a short person, you may have to devise a standing block or something so that they are up high enough so that they can get onto the seat safely. And their caregiver, if there is one, doesn't have to lift them, or they're not sitting on the edge of the chair trying to grab themselves and slide back into the chair. Seat to back angle is important for transfers, because if it's too upright, especially if you're doing mechanical lift, we all know the position you get in a Hoyer or a mechanical lift. It's kind of a reclined position. If the seat to back is too high, you're not going to be able to get them in and get their hips back. They're going to land on the front of the chair and need to be readjusted. We're also going to look at the consumer. What's their range of motion? What's their strength? How do they sit? Are they symmetrical, or do they have a severe scoliosis so they're all the way over to one side of the chair, which makes the stability of the chair a little bit different? What is their static and dynamic posture? As I said, this is not a static activity you're doing in the shower commode chair or the bath equipment. You need to be able to move, to access areas to clean, to be able to reach, and you need to be stable. So what do you need to do to the equipment so that is safe? What's their bowel care routine? What do they need to do? Do they need to do digital stim? In that case, they need to be able to access. They need a way to get in. Are the wheels too high so that you can't get in? Do you not have the cutout in the right place? Or can their caregivers access the areas they need to within the frame of the chair? I find it's 50-50 whether people who come from the front or the back or the side, actually, so it's 33-33. Each person has their own routine that works for them, and you don't want to provide equipment that doesn't allow them to do the routine that works for them best. And lastly, are they an independent propeller? Do they want to be able to move by themselves? Or in the case of some people who don't have assistance, they need to be able to move from the shower to the toilet to the bedroom. What do they need for wheel positioning? There we go. So when you're looking at, you've got your consumer requirements. Now you're going to look at how you're going to match that to the bath equipment. The seat to back angle, does it need to be open a lot? Does it need to be dynamic? I know sometimes when I'm doing a mechanical lift transfer, I will tilt the chair back or recline it so that I can get the hips back into the chair, and then I bring them back up so they're in a functional position for the shower. What about the seat depth? If you don't have, if you don't have the range of motion at the hips, you've got to have the open seat to back angle, or else in order to sit in that chair, they're going to be sitting on the front of the chair, and the commode opening is going to be wrong, and the alignment's going to be wrong, and you're going to have a mess. The seat depth is important, especially if you have knee flexion contractures. You want to cut down on the seat depth so that you're not pushing into that popliteal space, possibly causing injury either to the vascular system or the nerves. Or if there's pressure and pain, the person's not sliding forward to relieve that pressure. Again, misaligning the alignment in the chair. The shape of the seat and the location of the opening. I talked about this a little bit, that you need to know where they want the access. Does it need to be in the front? Does it need to be in the side? Does that opening need to be in the middle and the front? I find that when I'm working with people with severe adductor spasticity, I don't want a front opening, because what happens is the legs adduct and one of the legs goes through the opening and they get stuck during the transfer. In those cases, you might want a side opening. The opening shape and dimension. So we're talking about the commode opening. By walking through the streets, you can tell everybody's bottoms are not the same. It would be nice if they were, then we could only have one type of seat, but they're not. And you need to find out what they need so that their coccyx and their ITs are not pressing against it, so that they're comfortable and getting enough support so they're not falling through it. I once worked with a young man, who was 30, he was young, who, because of his anatomy, had to have an opening that was so small that it took us 3 to 4 tries doing custom seating, a custom seat insert with an opening, so that he had the support he needed, didn't have the pressure, and had good relief and the ability to access the commode, the toilet bowl, and comfort. If it's not comfortable, no one's going to sit in it. If it's harder than a rock, they're not going to do it. And you don't want people not to be doing their hygiene routines, especially bowel care. We looked at their posture and their sitting balance. If they have impairments in either of those, you need to provide supports in the chair that are going to enable them to be upright as midline as possible and maintain that while they're doing the shower. If you have somebody who needs gravity assist, you can do a tilt or a tilt recline, and they can, like you do with a tilt and space wheelchair or a tilt and recline wheelchair, you enable gravity to assist. You accommodate the hip if you've got an open hip angle, and then you use gravity to help them keep their trunk up. Another time you may need tilt and recline is if you have people that need to be repositioned quickly. That I can think of orthostatic hypertension. Sometimes you need to get the head down. Sometimes autonomic dysreflexia, which can be bowel obstruction or constipation, and full bladders, we all know, are triggers of autonomic dysreflexia. It can also be pain. So if somewhere in that transfer or in that seat, they've hit it wrong, there's a pain stimulation, they need to be repositioned when they're having a dysreflexic event. Do they need head support? For most parts, you don't need head support when you're in a shower chair if you're upright, but once you get into tilt or recline, you need to have something so the head doesn't go back. For trunk supports, do they need it laterally? Do they need it to swing away? If you're doing a transfer, you're going to need the lateral support to swing away. Do they need something that's just enough to give them centering and give them a little bit of support? Frequently, I've used the canvas or the sling backs in an upright shower chair and relaxed it so that I can sink somebody back in a little bit between the back posts. They have enough support to maintain upright, but I'm not adding more things that need to be moved while they're doing their showering routine. And some people, all they need are armrests. Armrests are enough to give them that lateral definition, that little bit of support, so that they're not going to go lateral out of the chair. Do you have a patient who needs to hook to be able to do their care? By hooking, I mean, I'm hoping you all know what it is, bringing the arm around the back of the chair and stabilizing at the elbow so that you can lean forward. It's frequently used to do foot care. Sometimes people need it just to be able to weight shift so that they don't lose their balance. Some of the shower chairs and commode chairs don't have the ability to do that. They have a single post. So you need to know if the person needs to be able to hook, you need to provide that in the equipment. Armrests, they need to flip back or swing away, get out of the way for the transfer. But how are they coming back in? Is the person bringing them back in themselves? As a caregiver, are they able to access them to bring them back in? Do they need them just for a little bit of support to provide them, to let them know where the edge of the chair is? Or do they use the armrest either for the transfer? A lot of people will reach over, grab the arm, and pull themselves into the chair. I have a lot of patients who used to use their armrest, hold on to it, pull themselves forward so that they can lift up their posterior. In that case, you want to make sure that the armrest locks in place, because if they pull up and the armrest gives away, they're just going to come forward. Leg rests we talked about. They've got to support the feet. Are they able to get on the footrest? Do you need to bring it in? Do you need to bring it forward? Can it get out of the way? And if it can, how does it come back in? I don't know how many times I've done transfers and the leg rests were in the way, so I picked them up and I moved them across the room. Or I picked them up and put it to the side and I tripped over them. Is that a risk for these patients? And if so, what can you do? Skin integrity is so important. When ideally, you would want to pressure map somebody on the seat that they're going to get, because you want to make sure that the ITs are centered in the hole, but there's still enough support and they're not pushing. And the coccyx and the sacrum, if they're sacral sitting and they're digging it into the edge of the opening, is increased pressure and going to cause an injury. I've had people in the past that I've had pressure injuries and I've mapped them on their chair, I've mapped them in their bed, I've mapped them everywhere. And I'm like, let's map the shower chair. And it's always the shower chair. You need to get their history. Do they have pressure sores? Where is it? How deep is it? And what is the shape? The shape of a pressure injury is going to tell you a lot of information. If it's perfectly round, it's a downward pressure. If you get any elongation in any direction, there's shearing going on, or they're sliding, or they're sitting awkward. I was at a presentation a week or so ago, and they told you to look at the undermining. The undermining of a wound will tell you the direction and the shearing that's happening. So you really need to look at the wound. And I know you ATPs are like, I'm not looking at the wound, which is fine. I understand it's outside your scope. But the therapists out there, you can look at the wound. If you're going to be working with somebody with a wound, you need to see what it looks like, not just that it exists. If they've had previous pressure injuries, how did it happen? When did it happen? How long ago? If it's recent, you've still got tissue that hasn't returned to normal, or as normal as it's going to be, it's still weak tissue, you need to address it. So when you're looking to choose your equipment, if you have somebody who's at high risk of pressure injury, somebody who has a history of pressure injuries, somebody who doesn't have sensation, they're not going to be able to tell or to move. You're going to have to provide pressure distribution. We're lucky that most of the cushions out there, or the seats and commodes, have some type of pressure distribution in them. Part of that is the material they're made of, and part of it is the size and shape of the opening. You need to support that unique pelvis in the position it needs to be without compromising pressure or increasing pressure. Sometimes it just can't be done with the equipment that you have, and you need to add additional pressure distribution surfaces like you do in a wheelchair. Rojo makes one, Acton makes one. There's a few others. Rojo and Acton are the ones I tend to use. I've actually worked with people just doing tub transfer benches that we've had to get a huge Rojo cushion to put it on the tub transfer bench to prevent them from further skin injuries. If you have a person who's a little hippie or has a little extra tissue along the thighs and the buttocks, you may need to put side guards, especially if they're a propeller, independent propeller, and they have a shower commode chair with the large wheels. You don't want the thighs to be rubbing on the tires because you don't have clothes or anything to protect. It's just skin to tire contact. You need to see if you need that, to see if you have to incorporate that into your chairs. For seat openings, they come in all different shapes and sizes. We've got front openings. These are side openings. We have a cutout here for the coccyx. They're different materials, and you can get custom ones. Someone this morning asked, how do you get custom equipment? I've always gotten it through a Medicaid system, but you have to do the openings. Almost all of your shower chair manufacturers will do custom openings and sometimes custom frames, but don't be afraid to ask. If you can't get it, you make the best with what you can, but if you ask and get the shape so that the caregiver knows and has the ability to access, the consumer has the ability to access what they need, and they've got adequate pressure distribution, you're a long way to having a successful shower commode chair. Environmental assessment. I know this is very difficult, especially for those of you who work in clinics. You're dependent on the consumer or the caregivers or their family to provide you with measurements for the bathroom. I want to impress on you that you need to have these. You need to have them to make sure the equipment is going to fit and be functional in the bathroom. The dimensions you need just from the room would be the door width, the overall clear space or turning radius, the clearance in front of the toilet, the clearance in front of the tub or shower to the next thing, which here in New England, it's always the toilets next to the shower and the tub. It's always right there. The overall width and length of the tub. You need to take into consideration anything that's in that area that will encroach on your available space for the consumer and the equipment. It can be towel bars, it can be grab bars, it can be the faucet, it can be a shelf, and very popular are those nice bath seats that go along the back of the tub and shower, which in my opinion are completely useless. Great place to put your soap. And shower thresholds. I've seen numerous people who said, yes, we have a full walk-in shower, and you find there's a 2-inch threshold. You need to figure that out, because if you have a roll-in shower chair, it's not going in there, or at least not willingly. I'm hoping and assume that you all know when we measure door width, we're measuring with the door inside the frame. We're not just measuring the outside frame, because the door can take up to 2 inches of width. 32 inches is recommended. Here in New England, I would say the majority of the doors in the older buildings are 29 inches, and some are even less. Why is that important? Because you need to make sure the width of the chair is going to fit through that door and they're not going to get stuck. They need to be able to, if they're independent wheeling, not only does the frame of the chair need to fit, their hands need to fit, or they end up doing, you come up to the door, you grab the door frame and you pull yourself through. Could not be the safest thing with a wet body. Then you want to look at the clear floor space. The ADA recommends 60 inches of a circle, so you have a turning radius of a chair. Some of the bigger chairs, when I was working at one of the institutions here in Mass, and we were sending people out into the community and we're building new residences, we found that our chairs needed a 6-foot turning radius, not a 5-foot, a 6-foot, because when you get the big tilt reclines and you've got a long chair, you need to be able to get it in, because you don't want somebody in there moving, picking up the tires, moving it around, picking up the chair, moving it around. You want to have clear. Is it always going to happen? No. But if you don't have that, you need to know when you're doing the equipment prescription. This shower doesn't have all of the components I just said. There's not a 60-inch turning radius. There's not 60 inches in front of the toilet, but they're able to work with it. The shower commode chair, yes, I know it's an old one. Pictures aren't easy to find, but it has adequate space for the chair it has. This chair also has 4 swivel casters, which when you don't have the big rear wheels, you can cheat a little bit on that space because you don't need the big turning radius. You can turn within the dimensions of the chair. The clearance in front of the toilet, I don't know anyone who has 60 inches in front of their toilet. Not in a house that hasn't been, a new bathroom has been put in. Most of the people I've worked with, I'm going into their existing home. They've either been injured or have come to the point in their disease process where they can't use the standard shower and bath anymore, and they need something to be safety. And the 60 inches, just, I rarely see that. This bathroom, you can see they have good turning radius. We'll talk about the shower later. They've got good adequate space on either side of the toilet, and they can get in and maneuver. In this picture, we have nothing that I've talked about, but it works for him. He is able to do it. There's not the radius, the clearance in the front of the toilet. There's not the clearance from the sink to the wall. He does use a chair with big arms. I know his footrests are too high. His knees should be able to go under. But he has a door here and he's able to maneuver and to do his routine. So sometimes, I know you ATPs hate this, but sometimes you really need to do a demo. You need to bring the product into the home, because is it worse not to take the product into the home prior to ordering, or is it worse to get to delivery and find out that they can't use the product and they can't accept it? Clearance from the tub or shower, wherever is. Here we have typical setups. The toilet's always next to the shower. You need to have 18 inches there. And the reason you need it is for A, to be able to maneuver and get close enough. B, if you're doing a tub transfer bench, you need to get your wheelchair close enough so that you can transfer onto it safely without hitting anything. In this picture, you've got plenty of room for the caregiver. You need to also, if somebody is dependent on a caregiver for assistance with their daily routine, there needs to be a safe space for them to work. You need to make sure that they're not going to get injured, or the consumer's not going to get injured because they're losing their balance. They don't have enough room to turn. Length and width of the tub. You need to measure this at the bottom of the tub, not at the top, because where the equipment is going to sit is on the bottom. You need to make sure you have enough room for the equipment to sit. You also need to be cognizant of, all tubs are slanted a little bit so they drain. Is the incline going to affect the stability of the chair? All chairs pretty much have height adjustment, but that fine tuning, it could rock. And in some cases, the instability could cause spasms, or the person just doesn't feel safe and they're not able to do their routine. You also need to be cognizant if it's curved on the sides. People measure the wall to wall of the tub and say, oh, I've got a 15-inch tub. I know that's not true. I hope it's not. But when you get down to the bottom, because of the curve, the only flat level surface you have is about 13. You lose a couple inches. And if you need to be able to stabilize that system, because you've got a wet person transferring on there, they're in the chair, they're moving around. And if you start getting rocking of the system, the potential for an accident just increases. Now, this looks pretty good. I always love them. They say you can go from the commode to the tub and just slide over. I've not had anyone that ever worked. They always have to come out and go forward. It looks in this, I'm pointing to the wrong screen. It looks like this fits fine, but think if you put a person in here and you're going to wash their hair and the water's going to come here and then it's going to go down on the floor. Okay, so I'll move it forward so that I can wash their hair and their upper body and not get water on the floor. Then their feet are hanging over the edge of the tub, or they're hitting the wall of the tub. You need to find the position that the consumer is going to be in the product and measure that full length and make sure you have that much usable space in the tub, or you're going to compromise the function of the equipment and the ability for the person to safely bathe. Showers have their own problems. The width of the shower floor, the length of the shower floor, it's the same as the tub. You need to know what you have that's usable. The height and width of the threshold. I've gone into homes and said, yes, we have a big full open shower, and I see there's a 2-inch threshold to get into it. Some of the smaller ones, I've been successful in using the rubber curb ramps to go in. But if you're doing an independent propeller, you have to come in and you turn. So you need to have the width in the shower. And when you put a ramp in, then you get cockeyed. And I've also seen people, my heart stops every time. They're in a mobile shower commode chair with the large rear wheels. They bring the person up to the shower. They tip them back, put the casters over the lip, then pick the chair up and over, and then pick it up and move it in the shower. That's not the safest thing for anybody. So you need to take that into consideration. The width of the shower floor is the width on the floor, not on the top. And what the usable width is. If you have somebody whose arms are out to the side, you're not going to do the full width of the shower chair. I've had a lot of clients that have brand new roll-in shower stalls put in, and they're the one-piece fiberglass one. But when you're using a chair with self-propel wheels, you can't get in there. You have to go in and turn and do about 6-point turns, or somebody comes in behind you and picks up the back. Make sure there's enough room for the shower chair to fit. This one looks pretty good. We've got plenty of room. The grab bar's not affecting. We've got room in the front. We've got room in the back, and the chair's all within the surface. The length of the shower floor. This comes into play, especially when you're using tilt and space chairs. But in some cases, I've had people with just standard upright slider chairs. We get them in because of the surface of the floor of the tub. It had to be moved forward. And when they got in the shower, their feet were hitting the faucet and the front edge of the tub. So make sure you know what the usable space is for the equipment that you're going to use. This one's great. It's basically a wet room. If everybody could have wet rooms, our jobs would be so much easier, because almost any piece of equipment will fit there. But they've also considered the amount of room that the caregiver needs. If the caregiver needs to have access to the opposite side of the person, they need to either be able to get around or get in front instead of reaching over the person, and they need to do it safely. The height and width of the threshold. I talked about this a little, that I've seen some anywhere from just the rubber ones, which are okay, but they leak, to 4 inches high. You need to be able to clear it. And then I had this one. This is my friend Liz, who I've worked with off and on for 30 years. Her family bought her a condo, and they put in a shower. the floor of the shower is 9 inches. That threshold is 9 inches from the floor of the bathroom. Any slider chair, we had to get a custom slider chair to use it. But prior to this, she was using a plastic lawn chair. Her PCA would pick her up. She's totally dependent. She's a mechanical lift transfer. Her PCA would pick her up, lift her up and into the shower chair. And then we had a wet body and a shower chair that didn't have postural supports. It was quite unstable. And if you couldn't guess it, the PCA hurt her back multiple times. Is this setup ideal? No. Do we have adequate access? I don't know. We're able to come from the sides. She's pretty tight. It's one of those triangular ones, but it's what she had. So we had to adapt the equipment to meet her needs for safety and hygiene. Don't forget the protrusions into the tub. These can be those lovely seats. They can be soap bars or soap shelves, niches, grab bars. I've had many times that you go to get it in and the dang grab bar is hitting the arm of the chair and you can't get it all the way in. It's keeping it out. The faucet comes out so far that it's actually hitting the person. So when you're looking at the area that you're going to use for the equipment, make sure it's clear. You can cheat if it's up high enough and you can get over those things. Those are great, but you need to be aware of them when you're speccing out the equipment. This room has got everything you can imagine. It's got the cabinet there, which is blocking access to both the tub and the toilet. It's got the shower chair in the back. You can't see, there was a shelf coming out here. You've got a fairly large faucet. You don't have a lot of room between the commode and the toilet and the tub. It may be great, but it's not functional for a lot of people. Now we're going to talk about the toilet. Bane of my existence sometimes, but we all need them. You want to look at the height of the seat. You want to look at the overall length of the toilet. How long is it? Where does it go from the wall or the base? The width of the bowl and the base. So important, because not only are you trying to get a commode chair over the height, it's got to get back. At Lizzie's house, I walked in, I thought she had this great, it was a wall-mounted toilet. It was great. We measured it. It had a weird bend to it, and the chair didn't fit. We had to retweak the chair a little bit after delivery. The depth of the bowl. How big is the target you're trying to hit? The distance from the tank and the clearance on either side. So when you're looking at the height of the toilet and the height of the seat, if they're going to pick the seat up, you measure to there. If they're going to leave the seat down, you measure to there. The chair needs to be high enough to get over that. And we end up with issues when we get something high enough to go over the toilet that people can't transfer into it. Or the other issue is when you get the slider systems, I'm jumping ahead, they're high enough for the tub, but they're too high for the toilet. Remember, when you're going to use that and you're going to put that seat back up, you're taking up depth here. The overall length. How much real estate do you have to play with? Is the equipment you're prescribing going to fit adequately? So here we have a chair. The rear wheels, as we saw in the consumer and caregivers concerns, this is one of their big concerns, is that because of the length of the tire, it moves the whole chair forward. If I point, it's better. So we're moving the whole frame forward because we're going to hit here. Also, the angle of the back is hitting the tank and moving things forward. You need to be able to cover it all and get the opening lined up with the tank. I know this sounds basic, but it's so many times we forget it. The width of the toilet so that you have enough width and clearance under the chair. The depth of the bowl. Is the seat with the commode opening going to fit in that area? Or are you going to be too far forward? It's a small bowl. Or if you have the elongated bowls, is the front of the chair going to hit the bowl, the front of the bowl, and not allow you back in? This, I think, is one crucial measurement that we always forget to take. The depth from whatever surface you have back here to the center of the bowl. When you're measuring for the chair, you need to find where the center of the bowl is to the furthest point, so that you know that that opening is going to line up with the toilet bowl itself. Come on. So here we have the chair. We have the small wheels, which makes it easier. But if you notice here, the sling back is being pushed forward. So that's going to push the person forward. If they don't have the hip range or they don't have the comfort being forward a little bit, they're going to scoot their pelvis forward to get comfortable. Remember, it has to be comfortable. And they're going to move forward on the seat and cause malalignment. It's the only way I can say it. Other things that come into play here are push handles. I've had push handles hit the back of the tank and move the chair forward. I've had just the bars. If you're not wide enough to clear the bowl and you hit the tank, you're going to move forward. For everyone's happiness, it's important that the commode opening aligns with the bowl so you have a success and we don't have a mess. The overall width of the tank, the bowl, and measure all the way down. When we did Lizzie's, we measured up here, but we didn't notice that the tank came and went out. I didn't have a picture of it. So that when we went here, the side frame of the toilet, the commode chair, was scraping the side of the toilet. I didn't think it was a problem, but her father didn't like the fact that we were scratching the porcelain. So we had to redo it. You need to make sure that there's enough room in the base so that you can get all the way back. I know this is picayune, but it saves you time in the back end. And here we have a chair that the width fits fine. You got plenty of room. You got plenty of depth. You've got the alignment of the commode opening and the toilet. You've got a little bit of a gap there, which you're going to have, and sometimes those gaps are greater, which causes leakage. But if you know what you're working with, at least you know what to expect. Clearance on the front and sides of the toilet. This is important for a couple things. Number one, if somebody's independent, they need to be able to lean most of the time. If they're dependent, there needs to be enough room for the caregiver to get access to what they need to get access to. And sometimes if it's in some houses I've been in, there's only been like 6 inches, and trying to get the width of the chair, the person's arms and everything in there is difficult. So you maybe need to make a choice. Can the width of the seat be smaller so we get the chair smaller? Or can we figure out a way so that the person can have access? This chair fits nicely, even though it's got that weird shape. Oh, wrong screen. Sorry, guys. It has a weird shape. We're able to clear. We're able to get back. There is a front bar here, but it's not preventing the commode opening from getting over the center of the tank. Sometimes if the bar is here, it'll bring the chair forward. You've got good height. There's not much of a range here, so you've got less chance for leakage. The back's not being pushed forward. You've got pretty good space on either side, not great, but. So what does all this mean? You've got your consumer's needs and what their stability, what they look like, what they need to succeed. You've got the bathroom constraints. So you know that this person needs a tilt and space chair. I've measured the overall length of the chair to be, and I'm grabbing numbers, 60 inches. So I need to have a minimum of 60 inches and preferably 64 inches from wall to wall in that tub. So that, in that shower, so that I'm not causing a potential for an accident or injury. When you're looking at CRT bath equipment, you start at the very basic. The people who have good sitting balance, is a tub transfer bench. They come padded and not padded. They have commode openings or not. I'm not a big fan of commode openings in a tub transfer bench because on your way over, you can sometimes get stuck in the hole. And the front opening, most of your tub transfer benches, if they have a commode opening, it's going to be in the front and legs fall through and get stuck. Height adjustable, you need to have the height adjustable so that you can clear the wall of the tub. You need to be able to get over that, and you don't want it just resting on it because it's going to shift a little bit and you can get a teetering. The problem with the height adjustable is if you got it high enough to clear the tub, it may be too high for the person to transfer. So you need to really look at that and make a decision with the consumer's input, the therapist, and the ATP. What is the biggest need for this person? They come with armrests or not. A lot of people will reach over to the armrest and use that to pull. So you need to make sure it's stable on the floor and not wobbly. There are some that come with a second armrest that flips down. If the person needs to have that extra lateral support because they've got a little bit of impaired balance, you get one of those. You need to have pretty good trunk and sitting balance. It can be dependent or independent transfers. If it's a dependent transfer, you need to make sure there's adequate room for the chair or the surface they're coming from and for the person transferring them. If the person's tripping over or straddling the toilet, you're looking at an injury waiting to happen. We already talked about that. Sliding bath chairs, because I worked with a lot of bathrooms that were not roll-in showers. They weren't big. I've used a lot of sliding bath chairs. They're height adjustable, but they need to be level. Most of them need to be pretty dead on level from the shower chair to the transfer portion, or else they don't slide well. Again, you can get solid cedar commode openings. Some of the manufacturers, you can get custom openings made and custom seat cushions. You just need to ask them. You can get postural supports. You can get lateral supports. You can get hip belts. You can get chest belts that are all designed to be used in a shower and they dry quickly. There's multiple ones on the market. And you can get tilt. But remember, if you're using tilt, you're going to have to make sure you have adequate space and free space in that tub for the tilt to be operated on. You've got to have the floor space to come in to hook up the bridge to go. I worked in one home, very old home, and we had a very minimum space. It was your typical sink, shower, toilet along one wall, and I think we maybe had 2 feet of space between the wall and the tub. We were able to get a custom bridge so that she could actually use her tub. She was a paraplegic. But you need to make sure there's enough space in there. You need to make sure that you can actually slide in. The length of the equipment and the individual. Remember that when a person is in the piece of equipment, the length increases because you got feet sticking out and head sticking out. Dimensions of the toilet and the location, because you're going to have to try to get over this. If you're using a tilt and space chair and trying to use it over the toilet, it ends up being really high. Also consider the height of the seat for the caregiver. If the caregiver has to lean way down, it's going to make showering difficult for everybody. The tub dimensions and the tub floor curve all affect it. You need it to be stable and not rock, and also fit in the system, in the tub that you have. Mobile shower commode chairs. Rehab shower commode chairs, you've got tilt recline combination to adjust the postural supports and needs that the person needs. You have the back options. Solid seat commode opening, again, shape and size can be changed. Most of them offer standard and you can have custom. Height adjustable, these especially, you want the height adjusted for the caregiver. You don't want them reaching over. You don't want them bending. You want them to be able to provide the care that they need without injuring themselves. you have to have a roll-in shower. It has to be a level entry shower or a minimum height. You have to have if you need an increased seat to back angle for the reasons we mentioned earlier, you can do this with shower commode chairs. If you need to change your orientation in space, it can be done relatively quickly. You have external supports and decreased trunk control and sitting balance. You can address this and set this up pretty much like a customized manual wheelchair to provide all the supports they need. But remember, the supports need to be able to be moved because you need to clean the skin under them. It's for dependent transfers, and you can use it either over the toilet or with a pan if you choose to use it for your bowel care program. Self-propelled back options with and without postural supports. You still have the seat and commode openings. They're height adjustable, not only for caregivers, but mostly for transfers. And actually, what's going to guide you on the seat of on the height of a chair is the height of the toilet. You need to be able to get over the toilet if you want to use it over the toilet. Some people like using it with a pan. I had spoken to a gentleman who loves his seat pan because his bowel care routine takes hours and he's not stuck in the bathroom the whole time. He's able to go about his day while his bowel care routine is happening. They have independent mobility, a roll-in shower. We talked about the toilet or the pan. You can have external supports and you can have dependent or independent transfers. I know it was a lot of information and a lot of detail, but not all bathrooms are created, just like none of our consumers are created equal. If they were, we wouldn't have all the options we have for seating and equipment because everyone's a little different. Their needs are a little different. But when you're looking at bath CRT equipment, you need to take that consumer's needs and individualism, but it has to match the environment they're going to use it in for them to be successful. By forgetting a little thing when you get on delivery, chair doesn't go over the toilet. You raise it up so it goes over the toilet, then they can't transfer into it. You can troubleshoot them before you get it there. It's a match of taking both the consumer and the environment, putting it together, finding out what your criteria are, and then matching it to the CRT equipment that's available. You have to be careful. Safety of the patient and the caregiver is priority and should be your first thought. Is this going to be safe? So any questions? Thank you, guys. Does anybody have any questions? Doug, the kitchen program, I'm going to have to find an OT. But I will keep that in mind. The slides are available either in the chat or you can go onto our website. Thank you, everybody. Any other questions? Oh, I use everything. For the brands, I use, of course, I use activated brands. I have some consumers that have been using the same Activate chair for years. That's what they're comfortable in. I've used the other manufacturers. I pick whatever equipment is going to fit the criteria of the environment and the user. And sometimes it's not easy, but you keep trying until you find it. A lot of searching. So I can't give you one that I use over the other.
I think there's a couple that are just kind of buried in the chat here now.
Oh,
So I've got one. How
Lisa, thank
often
you for the spelling. Sorry.
how
My
often do you get
proofreader
a
didn't do that good.
custom chair covered by insurance?
Most places it's 3 to 5 years.
Uh-huh.
But
What
the
do
one thing
you
with insurance is if the status or condition of the person has changed prior to their 5-year rule or 3-year rule, it's always worth trying because they are not the same person. The equipment's not meeting their needs and they're at risk. So I would try to put in for it and explain that, yes, we know it's not within the timeline, but it's needed because of A, B, C, and D. And we can't modify the equipment they have to meet these needs safely. Oh, God.
what recommendation do you have for a clawfoot tub?
I live in New England. We have lots of them. As you do in Montana, you're going to need to get a custom height. So you're going to need to go to a manufacturer that will give you a custom height. At Activate, we will consider, and you can ask for custom modifications. I know some of the other manufacturers do. I don't know exactly what they are, but you're going to have a custom height tub to get over that claw. And you're going to need, because of the claw foot, the surface on the inside of the tub is 4 to 6 inches shorter than the surface on the outside of the tub. It's a lot of measuring, and I will be very honest with you, I've only been successful a couple of times. Sometimes I've used a clamp on if they just need like a tub transfer bench, one that would clamp onto the tub so that you don't have that height thing. But they're not my favorite because they don't provide a lot of support. I pretty much use every brand, Matt. Again, it's what that piece of equipment and that manufacturer offers. Will it meet what my consumer and my environment need? I can't say one over the other. Sorry. Thank you, guys. So we need to get rid of all clawfoot tubs, but unfortunately they're coming back. And the freestanding tubs, the new ones, I think are going to be just as much of an issue because they're also high.
Marianne, do you ever have success with insurance coverage?
It's mostly through the Medicaid system because, as we all know, Medicare does not consider being able to use your bathroom successfully a medical necessity. But there is hope. Some of the new managed Medicare programs, so you've got, here in Massachusetts, we have Tufts. They will cover bath safety equipment. So you have to look at the coverage and provide the documentation, which, except for Medicare, you can pretty much provide it with just giving them the status of the person, their risk, and what would happen if they wouldn't have the equipment. Yeah, bath boards, you've got to have somebody who's got good balance, good cognition. Covered that. The recording will be available usually 1 to 2 weeks, Sam.
Yep. We will take this recording, and once we get it edited and everybody here has the opportunity to take the survey, we will put that online.
Doug, I know the devices that mix the water exist. I don't have any information on them. I would look at like plumbing supplies or talk to a plumber. Tina, I will send you who the local rep is. I don't know it off the top of my head. Tina, actually, could you email me? Because that way I won't forget. My email's on the screen, marianne.girardi@ultimatemedical.com, and I will reply back to you with your rep. I would recommend starting when they're in the rehab hospital. I know you don't have access. It's another way you can tell how old I am is that we used to always do home visits. I worked at acute inpatient rehab here in Boston. You can't do that anymore, so you need the family to do your measurements, or if your ATP is able to get into the house. The other thing one thing that COVID gave us is video chat. And you can do a video call and guide them through the measurements you need. Mason, I'm not quite sure what your question is. Mason, email me with some details because I know we need to close down the webinar. But email me with detail about what it is, or did you just come on? And then I'll answer it. And if anybody has any questions, feel free to email me. You can try to call me. It's not, if I'm around, I'll answer.
All right, so we're getting to the end here. Thank you everybody for your attendance in today's webinar. The link to the course slides, like Marianne said, is in the chat, and it's also available on Ultimate Medical's website, ultimatemedical.com/education under our upcoming webinars tab. Obtaining your CEUs should be easy. To receive your CEU certificate, you must complete the survey at the end of this course. The survey should automatically populate in your web browser when you exit the webinar. If the survey doesn't populate, don't worry, the link will be available in a follow-up email you'll receive from Zoom in approximately 24 hours. If you don't receive that email, please check your spam folder. Like we said, this course will be available on demand soon, along with Ultimate Medical's entire catalog of on-demand CEU accredited courses. I think we have 11 now. If you or someone you know would like free CEUs available on your own time, be sure to check out ultimatemedical.com/education, and that's ALTIMATE medical.com. We have a podcast, Positioning 365 Beyond Seating. It's available on Spotify and Apple Podcasts. Our host, Marianne, has covered some really interesting topics, including neuromuscular hip dysplasia and 24-hour postural care management, if you're looking to get some insights and a little more of a discussion-based just a discussion about some of those hot topics in the industry at the moment. Again, thank you for your attendance this afternoon at our webinar. We hope you've enjoyed it. If you have any questions after the conclusion of the webinar, please email us at education@ultimatemedical.com. And I think that's all I've got. So thank you, everyone.
Thanks, everybody. If you have questions on the topics and not the functioning of getting your CEUs and the recordings, email me directly. Thank you, Sam, for staying and doing this with me.
Mm-hmm.
And thanks everybody for joining us.